Don't get blinded by the light from fame. We're all ordinary people at the end of the day. We make decisions, some good, some bad, but we all pushing for things we never had.
Ordinary people with extraordinary ways.
Yeah.
Everyday people trying to make a way.
It's just us.
Ordinary people with extraordinary ways.
Yeah.
Trying to make a difference step by step each day. It's just us.
I want to talk to you about ADHD, and joining me is Dr. Theresa Cerulli. Dr. Cerulli, you know, I never thought about, with the transitions from the summertime to school, I guess that would be really challenging for parents with children with ADHD. What are some of the most common challenges and difficulties that parents face?
So the transition back to school can be difficult for everyone, both children and the adults, and with and without ADHD. So the transition is often challenging. But with kids with ADHD, it's all that much more of a hurdle sometimes, and that's because the core features of ADHD, which are inattention, hyperactivity, and impulsivity, it's often like putting a square peg in a round hole to ask these kids to sit still in a classroom for many hours a day, doing more rote activities compared to the lazy days of summer and the freedom that one has. So it is a tough transition for a lot of kids with ADHD, which, by the way, there are many. In other words, the statistics on ADHD may surprise you. 11% of children in the U.S. have ADHD, and that translates to about 6 million children. So it's a topic, I think, that really impacts a lot of families.
Wow, when you hear the number 11, that's small, but when you put it in perspective, that's a lot of people.
It is. So hopefully we can be helpful to the many families that are challenged right now in the back to school time. And both children and adults can have ADHD as well.
So how do you recommend that parents start preparing for the school year, and how soon should they start preparing?
Practice makes perfect, so the sooner the better in terms of getting ready for the transition. But I do recommend that parents schedule a meeting with your child's teacher, if you can, a week or two before school starts. If they're not available, then certainly a short time into the beginning of the academic year. And the meeting is an opportunity for you to describe to the teacher and collaborate with the teacher what are the specific challenges your child with ADHD has. Because those core symptoms I mentioned, the inattention, hyperactivity, and impulsivity, can present in very different ways from person to person and to different degrees. Some kids have a lot of the behavioral challenges, the real impulsive, hyperactive symptoms, and some kids have more of the sort of quiet, daydreamy, inattentive, staring out the window, but no one might have noticed because there's not a behavioral issue there. So meet with your child's teacher, describe what you see at home, describe what strategies have been helpful. The teacher may be able to use some of those same strategies that you've found successful at home. The teacher may be able to use those in the classroom. And then finally, of course, any of the prior experiences from previous school years that you can share with the teacher that have been, successful strategies in the classroom, helpful and or not so helpful things. The teachers really want to try and assist, and they're an important part of the treatment team. So try and include them from the get-go.
So Dr. Cerulli, you mentioned treatment. So what role can the doctor play in treatment as well?
Yes. The doctor is also a very important part of that treatment team. ADHD is a medical condition. It's not a learning disability, and I think people get confused about that. ADHD is a medical condition, and so meeting with your doctor is very important. And the doctor really brings another perspective, the medical perspective. There's been a lot of research and advancements and developments in the field of ADHD since I started 15 years ago now, and the options available for treatment are many. Compared to what we had, again, even 10 years ago. So meet with the doctor, get the most updated information and research and the ADHD condition in and of itself, which we now have a much better understanding of.
Yes, and so what are some of the advances in the field?
So for example, I've worked with Neos Therapeutics, company that developed Adzenys XR ODT, which it's a stimulant medication that it's an orally disintegrating tablet form. The orally disintegrating tablet dissolves in the mouth, does not require water. Dissolves in the mouth and you swallow it. It's a stimulant, so it is a controlled substance, which means that the FDA recognizes there is risk with abuse and dependence with stimulant medications. And so you want to really collaborate with your doctor, again, from the medical perspective, to minimize risks, to safely use a medication. This particular one, Adzenys XR-ODT, is FDA approved for ages 6 and above, so for adult use as well as children. But proceeding safely requires the doctor's input, and just thinking about what you can do at home, make sure you store your child's ADHD medications in a safe place to avoid misuse. Or even accidental misuse with medications.
So doctor, where can people go to get more information?
So besides talking with your doctor, there's the website adzenysxrodt.com for more specifics about the medication I mentioned. In general, for ADHD, CHAD, Children and Adults with ADHD, is a wonderful organization, another great resource for general information regarding ADHD.
Thank you so much, Dr. Cerulli. Take good care.
My pleasure. Thank you for having me today.
How can I help my daughter with her reading?
Searching for help with Dachshund breeding.
How can I help my daughter with her reading?
Information on hot water heating.
No. Sarah's bright, but when she's reading, she has trouble sounding out the words.
World music, playing track now.
No.
Let me try. Our daughter gets confused about which details in a story are important.
Which paper towels are most absorbent?
What?
Here are 5 product reviews.
Why are you not getting me?
See, I told you.
Wait, I was trying to show you how Sarah feels every day. Frustrating, isn't it? Redirecting to understood.org.
For the 1 in 5 kids with learning and attention issues, this is what life can feel like. Explore understood.org, a free online resource about learning and attention issues, designed to help your child thrive in school and in life. Understood.org, because understanding is everything.
Let's talk about sudden cardiac arrest. Joining me to discuss this topic is Dr. Thomas Callahan and Lindsay Davis, former Miss Ohio.
Hi, Charlene.
Hey, Charlene.
Dr. Callahan, let's start with you. Can you please tell us what is sudden cardiac arrest and how does it differ from a heart attack?
Yeah, a heart attack is a condition where an artery of the heart becomes blocked. And so the area of heart muscle that's supplied by that artery loses blood flow, and then that area of the heart can die. And that differs from sudden cardiac arrest, which is a heart rhythm abnormality. And in sudden cardiac arrest, the heart rhythm becomes so abnormal, so disorganized, that really the heart stops pumping blood effectively. The whole body loses circulation, the brain, the heart, everywhere. And then the individual can die within minutes.
And so, Lindsay, how did you discover that you were at risk for sudden cardiac arrest?
When I was in high school, I was a ballerina and I was dancing 7 days a week. I started having these episodes where I was passing out. I would just feel extremely fatigued. There were times after routines I couldn't get my heart rate to calm down. And I was looking around and none of the other dancers were experiencing what I was. And my dance teachers thought I was dehydrated, I didn't eat enough, it was too hot, or even it was poor conditioning despite dancing 7 days a week. And it wasn't until after dance class one day I collapsed at home and was taken to the emergency room where they discovered I have a heart condition called hypertrophic cardiomyopathy that puts me at an increased risk for sudden cardiac arrest.
Wow, Lindsay, so I hear about this happening to athletes all the time. So how has this changed your life day to day?
Fortunately for me, I was implanted with an Emblem subcutaneous implantable defibrillator made by Boston Scientific, who I'm partnered with today. And it's a device that continuously monitors my heart for abnormal heart rhythms. And should I experience that, it sends an electrical impulse to my heart, which would save my life. And because I have this device, I feel like I have a tiny emergency room in my chest at all times. And it's just it's given me that extra security, and I just feel like I can live a completely normal life. And I've been able to go on and educate on sudden cardiac arrest, and work with different legislative initiatives around the cardiac field.
Wow, Lindsay, that's some very good information. But you know, this could create a yikes moment for some people. And Dr. Callahan, I'm wondering, is this preventable?
That's a good question. You know, we can't always prevent the heart rhythm abnormalities, but what we can do is prevent people from dying from sudden cardiac arrest. And keys to that really are education, making sure people are aware of what sudden cardiac arrest looks like and are educated in performing CPR. And then from a medical standpoint, as a physician, we try to identify people that are at risk, or higher risk for sudden cardiac arrest. For those people, typical treatment is implantation of a defibrillator.
Thank you so much, Dr. Callahan. So Lindsay, where can people go to learn more information about this topic, especially those who are at risk?
I would definitely encourage you to talk to your doctor if you feel that you're at risk for sudden cardiac arrest or if you're involved in intense sports. There's also a brilliant resource online, sicd.com, and it provides a lot of information about sudden cardiac arrest in general, and also information about the device that I personally have implanted.
Dr. Callahan, Lindsay, thank you both so much.